Hello everyone, I'm Dr. Natalie Teo. I've been practicing as a urologist here in Singapore for more than 30 years now. Before that, I trained at NUS, then did my fellowship overseas and came back to serve our local community. Over these 3 decades, I've seen thousands of patients walk through my clinic doors at Mount Elizabeth, and let me tell you something. The issue I'm going to talk about today is probably one of the most common problems I encounter, yet it's also the one that men are most shy to bring up. You know what I'm talking about, right? Premature ejaculation. Finishing too fast, cannot last long enough, whatever you want to call it lah, the problem is the same. And I can tell you from my 30 plus years of experience, this affects way more men than you think. We're talking about 30 to 50% of men experiencing this at some point in their lives. That's almost half of all men. So if you're watching this video and you've been struggling with this, I want you to know first and foremost, you are not alone and there is absolutely nothing to be ashamed of. Today, I'm going to share with you 3 effective ways to reduce penile sensitivity so that you can last longer during intimate moments with your partner. And trust me, what I'm about to tell you is not something your regular GP will explain to you during a 10-minute consultation. This comes from decades of clinical experience, from talking to real patients, from seeing what actually works and what doesn't. But before I get into the solutions, I need to explain something very important. Most men I see in my clinic, they come in thinking they were simply born with a penis that's too sensitive. They think it's just their genetics, just how they're built, and they're going to suffer from this problem for the rest of their lives. Some of my older patients, they tell me they've been dealing with this for 40, 50 years already. Can you imagine? Half a century of struggling with something that is actually very treatable. Here's where most men go wrong. They assume this is purely a physical problem, something wrong with their anatomy. So what do? They go and buy all sorts of products, numbing creams, delay sprays, those pills they sell at those shops in Geylang or online. Some even ask me for SSRI antidepressants because they heard it can help delay ejaculation. And you know what? Some of these things might work temporarily lah, but they're just masking the problem. They're putting a plaster over a wound that needs proper treatment. They never address the root cause. Let me share with you a case. I had this patient, Uncle Tan, not his real name, of course, we have to protect privacy. He's 68 years old, retired civil servant. He came to see me and he was so paiseh, so embarrassed. His wife had to practically drag him into my consultation room. He told me he'd been having this problem since he was in his 20s. For over 40 years, he thought something was physically wrong with his body. He tried everything, spent thousands of dollars on supplements, creams, even considered surgery at one point. But nothing worked long term. When I examined him, you know what I found? Physically, everything was normal. His anatomy was perfectly fine. The problem wasn't in his body, it was in his nervous system. And this is what I want all of you to understand today. You see, if you have a very sensitive penis, it's probably not because you were born that way. It's much more likely because your nervous system has become dysregulated. Your body is stuck in what we call the sympathetic state. That's the fight or flight response. It's the signal that tells your body you're in danger. And when your body stays trapped in this mode, your sexual reflexes become hyperactive. Everything becomes hypersensitive, your sensations escalate too quickly, and before you know it, it's game over. Now, why does this happen? There are many reasons lah. For my older patients especially, there's often a lot of anxiety involved. You might have met a woman you really wanted to impress, and you were so scared of disappointing her, or maybe there's guilt or shame related to your upbringing. Some of my patients had very strict religious backgrounds where anything related to sex was considered taboo, or maybe you experienced some failure early in your marriage and that memory stuck with you for decades. I remember another patient, Mr. Lim, 72 years old, came to see me with his second wife. They got married late in life, both widowers. He was so worried about performing well for his new wife that every time they tried to be intimate, he would finish within seconds. The anxiety was killing him. He told me he felt like a failure, like he was letting his wife down. His body was so stressed that his nervous system was constantly on high alert. This is extremely common, especially among older gentlemen. You've lived a long life, you have many experiences, many pressures, work stress, family obligations, health concerns. All of these accumulate over the years and your body keeps score. It remembers all that tension. So what's the solution? The first thing we need to do is get you out of that constant stress state and help you access your parasympathetic nervous system. That's the rest and digest mode. That's the state where you feel safe, calm, and relaxed. Because instead of trying to numb your penis or drug your brain, we need to learn how to regulate our nervous system naturally. Let me teach you the first technique. This one is about proper breathing, and I want you to practice this before any intimate activity with your partner. Before you start anything, I want you to take a moment to observe yourself. Check your heart rate. Notice how your body feels. If you're feeling that absolute fear reaction, heart pounding, palms sweating, mind racing, almost like a panic attack, then please do not proceed with intimacy in that state. You're not giving your body any chance to have a positive experience. What you need to do is pause and regulate your nervous system through breathing, and not just any breathing. I'm talking about deep diaphragmatic breathing. Here's how you do it. Breathe in deeply through your nose. Let your belly fill with air, not your chest, your belly. Your stomach should expand outward. Then exhale slowly through your mouth. Let your stomach deflate naturally. Do this for 2 to 5 minutes before intimacy, or until you genuinely feel calmer and more confident. This deep belly breathing sends a clear signal to your nervous system. It's like telling your body, you are safe. There is no danger here. You can relax. And when your body gets this message, it naturally calms down and your penis becomes much less hypersensitive. I teach this to all my patients. Uncle Tan, the one I mentioned earlier, after just 2 weeks of practicing this breathing technique, he reported significant improvement. He went from lasting maybe 30 seconds to several minutes, and this was without any medication, without any cream, without any surgery, just breathing now. Some of you might be thinking, Aya, Dr. Teo, breathing only meh, so simple? Yes, it's simple, but simple doesn't mean not effective. In fact, the most powerful techniques are often the simplest ones. The problem is that most people don't actually do them consistently. They think it's too basic, so they skip it and look for some magic pill instead. Don't make that mistake. But to really maximize the effects and prevent yourself from slipping back into stress mode, you need to add this second step. This one is about making sound while you breathe. You see, most men stay completely silent during foreplay and sex. Why? Because they're stuck in their heads. They're worried about making mistakes, worried about disappointing their partner, worried about finishing too fast. So they hold their breath, they tense up, and this increases stress, increases nervous arousal, increases sensitivity, and leads to, you guessed it, premature ejaculation. The key is not just to breathe, but also to release your breath with sound. Even a small sigh when you exhale sends a signal directly to your brain, telling it that it can relax. It helps you exit that fight or flight state and regain control over your body. I know this might feel strange at first lah. Singaporean men especially, we're not very expressive one. We keep everything inside, but in the bedroom, this silence is actually working against you. You need to let it out. A gentle sigh, a soft exhale with sound, this releases tension from your body. Practice this breathing with sound during foreplay. It helps you self-regulate and reduce your penile sensitivity even before penetration begins. My patients who do this consistently report that they feel much more in control. They're not just reacting to sensations, they're managing them. Mr. Lim, the 72-year-old I mentioned, this was a game changer for him. He was very skeptical at first. He told me, Dr. Teo, I'm not going to moan like in those movies. I told him it's not about moaning or being dramatic. It's just about releasing tension through breath and sound. After he tried it, he called my clinic to say thank you. He said it made such a big difference. Now, there's one more factor that most men completely neglect, and without addressing this, lasting longer can become a real uphill battle. Most men who suffer from premature ejaculation do everything they can to hide it. They carry this shame, this enormous guilt, and the statistics show that 90% of them don't even dare to talk about it with their doctors. So if they can't even tell their doctors, you think they'll tell their partners? No way. And so, with no one to confide in, the pressure builds up. And that pressure makes the premature ejaculation even worse. It becomes a vicious cycle. You're anxious because you ejaculate too fast, and you ejaculate too fast because you're anxious. The secret is to create a sense of safety through open communication. You need to talk to your partner, tell her what you need to feel comfortable during intimacy, explain how you like to be touched, and most importantly, eliminate any expectation of performance around sex. I know this is hard for many Singaporean men. We grow up in a culture where we don't talk about these things. Sex is private, personal, not to be discussed. But let me tell you something. After 30 years of practice, I've seen that couples who communicate openly about sex have much better intimate lives than those who don't. It's not even close. When I counsel couples in my clinic, I always encourage them to have an honest conversation about expectations, and you might be surprised to discover that your partner is also feeling nervous or anxious. She might have her own insecurities. When both of you open up about these feelings, it can help both of you feel more relaxed. When your body feels safe, it regulates naturally, and that regulation reduces penile sensitivity and helps you last longer in bed. It's not rocket science lah, but it requires vulnerability, and vulnerability requires courage. Let me tell you about one more patient. This gentleman, Mr. Wong, 75 years old, been married for 50 years. He and his wife had basically given up on intimacy because of his premature ejaculation problem. They just accepted it as part of aging. When he came to see me, he wasn't even expecting help. He came for another issue altogether, and this only came up when I asked routine questions. I encouraged him to try these 3 techniques and to have an honest conversation with his wife. He was very resistant at first. At my age, talk about what he said, but his wife was actually very understanding. Turns out, she had been wanting to address this issue for years, but didn't know how to bring it up either. 3 months later, Mr. Wong came back for a follow-up. The change in him was remarkable, not just in his intimate life, but in his overall demeanor. He seemed happier, more confident. He told me that these simple techniques had transformed his relationship with his wife. At 75 years old, they were enjoying intimacy again after basically avoiding it for decades. This is why I do what I do. This is why I wanted to make this video today. Because there are so many men out there suffering in silence, thinking there's something fundamentally wrong with them, when the truth is that this is treatable. It's not about being broken, it's about understanding how your body and mind work together. Now, I want to address something that some of you might be thinking, some of you might wonder, Dr. Teo, you're a woman, how would you know about men's problems? This is a fair question lah. I've encountered this sentiment before, even from some of my own patients. Here's my answer. In 30 years of practice, I have treated thousands of male patients with this exact issue. I have studied the research, conducted my own clinical observations, and most importantly, I have listened to my patients' experiences. Medicine is about understanding the human body, regardless of whether you personally experience the condition. Cardiologists don't need to have heart attacks to treat them. Oncologists don't need to have cancer to help their patients. What I bring to the table is professional expertise, clinical experience, and a genuine desire to help. And I can tell you that the techniques I've shared today are backed by science and proven effective in my practice. They work because they address the root cause of the problem, nervous system dysregulation, rather than just covering up the symptoms. For those of you who want more specific guidance, let me break down exactly how to implement these techniques in your life. For the breathing exercise, start practicing it daily, not just before intimacy. Make it a habit. Every morning when you wake up, spend 5 minutes doing deep belly breathing. This trains your nervous system to access the calm state more easily. Over time, you'll find it easier to activate this relaxed state when you need it most. For the breathing with sound, practice this during your daily breathing exercises too. Get comfortable with releasing tension through sound. It might feel awkward at first, but like anything else, it becomes natural with practice. For communication with your partner, start small if you need to. You don't have to have a big dramatic conversation. Maybe start by simply saying, I feel nervous sometimes, or I want us to take things slow. Open the door to dialogue and build from there. I also want to mention something about lifestyle factors that can affect penile sensitivity and premature ejaculation. Things like alcohol consumption, smoking, lack of exercise, poor sleep, all of these can contribute to nervous system dysregulation. If you're serious about improving your intimate life, you need to look at your overall health as well. For my older patients especially, I always emphasize the importance of regular exercise. Even just walking 30 minutes a day can make a significant difference. It helps regulate your nervous system, improves blood flow, and reduces stress hormones. Some of my patients join those morning exercise groups at the parks and HDB void decks, Tai Chi, Qigong, simple stretching. These are all beneficial. Diet also plays a role. Eating too much rich food, especially late at night, can affect your body's ability to regulate itself. The traditional Singaporean diet can be quite heavy. Char kway teow, Hokkien mee, all that good stuff. I'm not saying give it all up lah, but moderation is key. And please, if you have underlying health conditions like diabetes, high blood pressure, or heart disease, make sure those are well controlled. These conditions can affect your sexual function in various ways. Work with your regular doctor to manage them properly. Some of you might also be wondering about when to seek professional help. If you've tried these techniques consistently for several weeks and you're not seeing any improvement, it might be time to see a specialist. There could be other factors at play that need to be evaluated. Don't be shy about it. We doctors, we've seen and heard everything already. Nothing you tell us will shock us. In Singapore, you can see a urologist like myself, or you can also consider seeing a sexual health therapist who can help with the psychological aspects. Sometimes a combination of medical and psychological support is the most effective approach. I want to wrap up by saying this. Your age doesn't matter. Whether you're 40, 60, or 80, it's never too late to improve your intimate life. I've seen men in their 80s make significant progress. The key is to stop thinking of this as something you just have to live with. Premature ejaculation is 100% treatable. It's not a life sentence. And the solution doesn't have to involve expensive treatments or risky procedures. Often, it's about understanding your body, regulating your nervous system, and communicating with your partner. I've been where many of you are, not personally of course, but professionally. I've sat with countless men who felt hopeless about this issue, and I've seen them transform their lives with these simple techniques. It gives me so much satisfaction to help patients reclaim this important aspect of their lives. So if you take away anything from this video, I want it to be this: you are not broken, your body is not defective. You've just been stuck in a stress response, and there are concrete steps you can take to change that. Try the breathing techniques, practice releasing tension with sound, have that honest conversation with your partner, give it time, and be patient with yourself. Change doesn't happen overnight, but it does happen. And if you found this video helpful, I encourage you to share it with others who might benefit. I know it's a sensitive topic, but spreading awareness can help so many men who are suffering in silence. Thank you for watching and trusting me with this personal topic. Take care of yourselves, and remember, your best years can still be ahead of you.